Hello, my name is Rahisha Gullidge. I'm a nursing student with Nightingale College, and this video I will be doing today is the subcutaneous injection. So I just got an order from the doctor to administer 1,000 units of heparin subcutaneous, 1 dose. I'll get all my supplies for the procedure. I will confirm the 6 rights, the drug rights of administration, which is the right patient, the right dose, the right medication, the right time, the right route, and the right documentation. I then will calculate the right dose, which will be 1 milliliter. Okay, so 1,000 units of heparin is what is ordered. What is available is 10,000 units per 10 milliliters. So then I'll calculate 1,000 times 10 divided by 10,000, which is 1. And that's 1 dose. Which equals 1 milliliter. Okay, so now I'll go ahead and introduce myself to the patient. Hello, my name is Rahisha Gullidge. I'm a nursing student with Nightingale College. How are you doing today? Great. Can I get your, and then I will go ahead and provide patient privacy, closing the door, the curtain, and identify the patient with using 2 identifiers. Can I get your name and date of birth? And I will look at their wristband and verify their name and date of birth. Yes, that is great. Okay, so sir, I wanted to go ahead and ask you, do you have any known allergies like food, medication, seasonal, any type of allergies? No. Okay. Then I will go ahead and inform the patient of the purpose. Today we will be going ahead and perform subcutaneous medication injection, and I will discuss its actions, its uses, its common side effects, and I will list them. And then I will let the patient know that sir, you might feel a slight burning, or you might feel a stinging sensation while I am administering the injection. Okay. All right, and then I will inform the patient that the doctor did order this, and I will instruct the patient and of any adverse effects, and I will list them, and I will ask the patient, do they have any questions? And sir, do you have any questions? Okay, no, perfect. Okay, so then I will go ahead and perform. And again, I explain to the patients the medication that I'm giving them, the actions, the uses of it, the common side effects, and I list them and let them know that they may experience slight burning or a stinging sensation while I'm administering the injection, and to report to me any adverse effects, and I list them. Okay, so I will go ahead and perform hand hygiene. Okay, and I will go ahead and put on clean gloves. Before I put on the gloves, I will go ahead and check the EHR again and check the medication, the prescription, check the medication, the dose, and just my third check again for this medication to make sure that I'm giving the correct medication to the correct patient and the correct dose. I will calculate again and make sure that it is the right dose, and I will go ahead and put on my gloves. I would like to know, in my package, I only got the 2 insulins. I have the 2 insulins, and then I have this practice demo dose, and then I only got these 2 syringes in my package. I didn't get any other. This is an insulin syringe, tuberculin syringe. Since I did just do my video of drawing of insulin, I'm just going to go ahead now and use this syringe for my heparin, and I'm going to use this since it is a 1 milliliter syringe. But I do want to note, for inside of my kit, those are the only valves that I received, just these 3. I didn't receive any more, and those are the only 2 syringes that I received in my package. So I would like to note that. Okay, so I am going to go ahead and open up my syringe. And again, this is a 1 milliliter 25 gauge syringe. Okay. And then I don't have any gauze or anything, but I'm going to use this as my gauze. And then I have an alcohol pad. Okay, and I'm going to go ahead and clean it. Oops. Trash. I'll go ahead and take the lid off my needle, and then okay, so I will then go ahead and I will draw back the amount of air plunger. I will pull back the amount of air as the medication, which is the dose, which is 1 milliliter. So I will draw back to 1 milliliter. Okay, and then so now I will hold the needle, the syringe, in my dominant hand, and hold the vial with my non-dominant hand, and then I will go ahead and and release the air. Make sure it's not touching. Release the air into the valve, and then I will invert it, flip it over, and then I will pull back until one milliliter. Okay, and then I will remove it. All right, the medication of heparin, 1 milliliter. Okay, so then I will go ahead and I will look for any air bubbles, and then I will tap them out. Okay. Okay. Okay, so I have now 1 milliliter You can see that. Okay, of heparin of one dose, which is 1 milliliter of medication, and the correct dose is 1 milliliter. So, okay, so now I will place this aside, and now I will pick the area for administration. Okay, so I will go ahead now and I will inspect the surface, select the appropriate site. I will inspect the skin surface, look for any bruising, inflammation, or edema. Choose another site if I see any bruises or signs of infection. I will then palpate, and I will make sure I avoid the areas where they may be like masses or tenderness. And I will select the appropriate site and make sure that it's the correct size, the skin, clean the area. With the alcohol pad, the center of the site, which is right here. So I'm going to first start, and then I'm going to go larger, wider, outwards in a circular motion for about 5 centimeters or 2 inches of the area. Okay, and then I will allow this to dry on its own. I won't blow it or anything like that. I will allow it to dry. And I would just like to note that I will measure the correct side by grasping this the correct side by grasping the skin fold at the side with my thumb and forefinger, and measure the fold from top to bottom to make sure that the needle is 1/2 of length of the fold. Okay, so I'm going to go ahead and hold the syringe between my thumb and forefinger as my dominant hand, and then like a dart, and then I'm going to, with my non-dominant hand, hold the skin across the injection sites, like pinch it with my non-dominant hand. I can't really do that with this one, but I'm going to go ahead and pinch it, and I'm going to inject the needle quickly and firmly at 45 to 90 degree angle, and then release the skin if it's pinched. So I'm going to go ahead and do that. Okay, and then with my non-dominant hand, I'm going to go ahead and hold it right here to stabilize it, and then move my dominant hand to the end of the plunger, and then slowly inject the medication over a few seconds. Slowly. Okay. And then I'm going to release that skin, and then I'm going to withdraw the needle very quick, and then I'm going to go ahead and place my my gauze pad gently over the site. I'm not massaging it, and then if it needs a band-aid, I will go ahead and put a band-aid on it. I'm not going to recap We do not recap the needle. I'm going to discard it into my band over here. I'm going to discard it. And I'm going to go ahead and remove my gloves. Remove my gloves and perform hand hygiene. And then I will go ahead and I will document this procedure. And I will leave the patient in a comfortable position. If everything is okay, if you have a call light, and yeah, and then document this procedure. And that is it for this video.